Bonjour à tous et à toutes. Je m'appelle Marc Miller, ministre des Services aux Autochtones. J'aimerais souligner d'abord que nous nous trouvons ici sur le territoire traditionnel algonquin. Je suis ici aujourd'hui avec ma sous-ministre adjointe principale, Valerie Gideon, et le médecin en chef du Service aux Autochtones Canada. Kwe Tanse Ulukut. Good morning. Bonjour. Yot gade satiohare, sasak tano tes antionk senant sogo. Qua oxaizi yazade ne wat station yonsin yongiru gewata. Zenohare tano sanraria tinue aguego se watsta tano tosa ganya hanchire neskarage zenyunge toganichi zagarunde. That took 20 seconds, which is the time everyone should be doing what I just said they should be doing. Wash your hands often. Cough and sneeze into your arm. Throw out used tissues right away. Clean and disinfect shared surfaces. Avoid touching your eyes, your nose, and your mouth. Those words are just as important today as they were 2 months ago. To date, of the 225 confirmed cases, 213 cases have recovered, as well as 16 cases in Nunavik. The flattening of the curve is encouraging. It speaks to the work and strength of First Nations communities, Inuit and Métis leadership. You've been successful in your efforts to stop the spread of the virus. Recognizing that this virus has affected nearly every facet of day-to-day life, we continue to support the delivery of quality care while Indigenous individuals and communities take the lead in responding to their unique and evolving needs. To date, the Government of Canada has made roughly $1.5 billion in distinctions-based funding available to Indigenous peoples in their efforts to successfully battle COVID-19. This funding included $285 million to support ongoing public health response to COVID-19 in Indigenous communities. As of June 4th, this funding has meant that we've been able to ship 890 orders of personal protective equipment to communities over and above the PPE shipped by provinces and territories and over above that shipped by First Nations Health Authority in British Columbia. We've also been able to increase the available of testing, swabs, and increase the number of healthcare personnel in communities. We now also have 179 temporary assessment, screening, and isolation units so that communities can have the space they need to address any potential increase in case counts and address concerns around safe testing spaces. This has included retooling existing facilities, getting ready to move trailers and mobile structures, and providing additional medical supplies and equipment to healthcare facilities. Communities' needs were also addressed through the Indigenous Community Support Fund, the total of $380 million, which included $90 million for urban and off-reserve Indigenous populations, as well as $306 million in funding and short-term interest-free and non-repayable contributions to small and medium Indigenous businesses. On that note, I'm pleased that the contribution agreement with NACA has progressed and that Aboriginal financial institutions across the country can now work with community-based businesses to address the immediate need and immediate financial impacts of this pandemic. La communication est au cœur de notre soutien des communautés autochtones, puisque nous continuons à travailler avec nos partenaires pour mettre à disposition des informations pratiques, factuelles et claires dans plus de 10 langues autochtones par le biais de la presse écrite, de la radio et des médias sociaux. Nous continuons à avoir des appels réguliers avec les dirigeants des Premières Nations dans chaque région. Nous sommes en communication régulière avec le leadership national des Inuits, ainsi que le groupe de travail sur la santé publique des Inuits, le comité de santé des Métis et les représentants régionaux des Métis. Nous sommes également en contact régulier avec les travailleurs de la santé au plan local, les médecins hygiénistes régionaux et les coordonnateurs régionaux de la gestion des urgences, entre autres, et nous coordonnons un groupe de travail dédié du comité consultatif fédéral, provincial et territorial chargé de relever les défis spécifiques des communautés autochtones éloignées, afin de garantir une collaboration intergouvernementale et la prise en compte des besoins uniques de ces communautés. C'est exactement la raison pour laquelle nous travaillons activement à l'extension de nos contrats d'infirmiers pour répondre aux besoins non satisfaits des communautés des Premières Nations. Nous évaluons également les besoins d'autres professionnels de la santé, tels que les ambulanciers et les intervenants de première ligne, pour aider aux interventions, évidemment, d'urgence. Enfin, nous coordonnons également nos efforts avec les provinces et les territoires afin d'obtenir plus de fournitures comme de l'équipement de protection individuelle, de l'eau en bouteille et du désinfectant pour les mains, là où c'est nécessaire. Compte tenu de la réduction des vols commerciaux et des restrictions de voyage qui sont en place, nous continuons à organiser des vols nolisés réguliers vers les communautés éloignées des Premières Nations afin d'assurer le mouvement continu des travailleurs de la santé, de la Direction générale de la santé des Premières Nations et des Inuits et des fournitures médicales, tout en minimisant l'exposition des communautés à l'infection. À présent, des centaines de professionnels de la santé ont pris l'avion pour se rendre dans des communautés isolées des Premières Nations en Alberta, au Manitoba et en Ontario. De futurs vols sont prévus pour que le personnel et les fournitures de services essentiels puissent atteindre ces communautés pendant toute la durée de l'épidémie. Across the country, our attention has been on those who are especially at risk, and many of our efforts have focused on providing relief to protect Indigenous groups that are uniquely vulnerable during this difficult time. We've introduced a national temporary measure to ensure that funding to First Nations youth in care, who reach a majority during the pandemic, continue to receive the supports they need. We've also expanded eligible expenses that will support First Nations agencies and communities to address emergency concerns, including issues related to COVID-19. Last week, we announced $270 million to supplement the on-reserve income assistance program to address increased demand to help individuals and families meet essential living expenses. We've also announced $75 million in new investments to support First Nations, Inuit, and Métis post-secondary and recent graduates impacted by the pandemic. We're also committed to $44.8 million over 5 years to build 12 new shelters, which will help protect and support Indigenous women and girls experiencing and escaping violence. And we will provide an additional $40.8 million to support operational costs of these shelters over the first 5 years and $10 million annually thereafter. That announcement also included $1 million per year ongoing, starting this year, to support engagement with Métis leaders and service providers on shelter provision and community-led violence preventions to protect Métis women, girls, LGBTQ, and Two-Spirit people. This Wednesday marked the one-year anniversary of the final report of the National Inquiry into Missing and Murdered Indigenous Women and Girls. It was an anniversary that brought to light a dark reality that persists in our society, a reality of fear, of abuse, of violence, and of loss. We've heard the anguished voices of survivors and family and community members affected by this enduring tragedy and remember and honor those daughters, mothers, grandmothers, aunties, and LGBTQ and Two-Spirit people who are taken from us. We've taken important and significant steps to address these concerns, but we also recognize that there is much work ahead of us. We're committed to continuing this important work with provincial, territorial, and Indigenous partners toward an effective and comprehensive national action plan to help keep Indigenous women, girls, LGBTQ, and Two-Spirit people safe and address the disempowering effects of colonization. Thank you. Miigwech, Nakumik, Marsicho. Merci.
Merci, Monsieur le ministre. Nous allons donc prendre les questions. On va commencer avec les questions au téléphone. Thank you, Minister. We will now start in taking questions. We'll take, as usual, one question, one follow-up. Une question suivie. Au téléphone, donc, modérateur, vous pouvez y aller.
Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question is from Mia Robson from the Canadian Press. Please go ahead.
Yes, good morning. You talked just recently about safety and security and violence against Indigenous women, but in the last week alone, we've had several incidents. We had the BC Independent Investigation Office recommend charges against 5 RCMP officers for the death of an Indigenous man. We have that Nunavut RCMP officer who has left the community after that video of the truck running into a man. And then yesterday we had the death of a woman in New Brunswick at the hands of police. What do you say to Indigenous Canadians who don't feel safe when the police show up?
I watched in disgust yesterday a number of these incidents. A car door is not a proper police tactic. It's a disgraceful, dehumanizing, and violent act. I don't understand how someone dies during a wellness check. When I first saw the report, I thought it was some morbid joke. And you look at it and you say, yes, there'll be an independent investigation. But frankly, along with many Canadians, Indigenous peoples living in Canada, politicians, I'm pissed, I'm outraged. There needs to be a full accounting of what has gone on. This is a pattern that keeps repeating itself. I spoke with my team a couple days ago, as a number of them are Indigenous and are feeling the 1 year anniversary of the report in a way that I'll never experience. And the issue of safety came up. And this is something that touches Indigenous peoples in a way that I won't experience it. My team and I saw it. We saw the real fear that was experienced at Tyendinaga, where I felt safe around police forces and they didn't. I can't speak for them. I can't speak for Indigenous peoples, but you can see it. It's palpable. It's painful. Police serve Canadians and Indigenous peoples of Canada, not the opposite. And it's something that we need to reckon as a society as we look south to the disgraceful acts that are occurring down there. These independent inquiries need to bring justice. That's my reaction. Next question, please.
Thank you. Follow-up?
For Indigenous communities ahead of the idea of a second wave? Is there anything that needs to be done differently? Anything to slow sort of the idea of future outbreaks in some of these very remote and vulnerable communities?
So I'm gonna answer that by asking Valerie Gideon to speak to it after I say what I'm going to say right now. The surge financing that we announced last week is in direct response and preparation for more targeted investments of resources, personnel, and equipment into Indigenous communities, acknowledging that second waves from any recent history that we can examine have been more impactful on Indigenous communities. And so our responses are tailored with the discussions we have with health authorities and political leadership in the Indigenous communities. Needs vary. The chartered flights that we fly into remote communities acknowledge the fact that there's been a drop in commercial flights. For example, the surge capacity that we announced last week for nurses and renewing contracts, making sure personnel gets in safely in a way that they don't themselves become vectors while they're trying to help the people that are more vulnerable. These are all aspects of how we learn. If we look at some of the examples for the cautious optimism with which we look at the response in La Loche to what really was a very alarming epidemic in terms of a proportion and percentage of the population, perhaps the greatest in Canada. The leadership has acted in an aggressive way to test, track, and isolate people that were affected. And so those are all elements that we can learn from. And in fact, these are lessons that the Indigenous communities can teach us, the way they treat their own aged that are perhaps even more vulnerable in terms of what they represent culturally for their community, and then perhaps even and physically. These are all things that we can learn, and the way we are arresting COVID in small communities is a lesson perhaps for all smaller communities, Indigenous and not, across Canada. And then on that, I'd pass it to Valerie, who's working essentially on the front lines to make sure that we're prepared.
Thank you very much. Good morning. So some of the important pieces to ensure that communities have in place is trying to expand testing capacity and ensuring that there will be testing availability. We have not had outbreaks in long-term care homes and First Nation communities, but we are very cognizant of those risks. So we are preparing specific supports and training for those particular workers and facilities, and we are working with partners such as the First Nations Health Managers Association to ensure that that will be available. That particular association has created an info point service, which is essentially a hotline that communities can call in order to be able to get support, to also look at testing their plans. So if they haven't had any tested positive cases on reserve, to make sure that they're actually taking this time to test their plans again, and to think about anything that they might be missing so that we can support them in that implementation. We also have the Canadian Red Cross that is available and reaching out to First Nations, Inuit, and Métis partners, as well as off-reserve Indigenous communities, to offer their services, again, to just look at what is in your plan. Have you tested your plan? Do you have all the resources required? So this is a time where people can reflect and ensure that they have everything in place. There is a bit of fatigue that sets in, and there is a bit of a tendency to maybe think about relaxing some measures, but doing so with proper guidance and doing it in a phased and measured way, and ensuring that you still retain the number of staff, the number of surge infrastructure. All those resources will be available to you at a moment's notice if, in fact, there begins to be new tested positive cases on reserve. So we are really emphasizing the importance of being vigilant and continuing to have maximum preparedness measures in place.
Merci, opérateur. Prochaine question.
Merci. The next question, la prochaine question, is from Jorge Barrera from CBC. Please go ahead.
Mr. Miller, James Smith Nation Chief Wally Burns wrote the World Health Organization recently, asking it to include, references to the unique needs of Indigenous people and UNDRIP and guidelines to government on dealing with this pandemic. As you know, they've put in a request to your department for about $120 million US to get PPEs. I'm just wondering, what is the status of that proposal?
Thank you for the question, Jorge. Our team has been looking at it, and we've passed it on to Health Canada for further discussions. As I had mentioned to you this time last week, we do provide resources for communities to be getting their own resources in terms of personal protective equipment. Now we're experiencing a transition into what we see as the new normal, which is a transition away from the use of PPE to frontline health workers, to a cautious use of them as we reopen the economy. So those are discussions that are ongoing and not limited not limited to any particular community, but it's a discussion we have to have in a very intense fashion across the country to look at what the needs are. But those are ongoing discussions that we will be having across the country. But that particular need, I believe, unless I'm wrong, has been passed on to Health Canada. Thank you.
Thank you. As a follow-up?
Yes. In terms of the data you announced today, 213 recovered out of 225. I'm just wondering, what improvements have there been in terms of your data, the department's data gathering, to get a full picture of the impact of the pandemic on the Indigenous population in the country? I know there's been work on that. Where are we with that?
Yeah, and again, Jorge, I'll let Valerie speak to the second part of this. We've been working, again, this is a group effort with all responsible jurisdictions, most importantly, First Nations, Inuit, and Métis leadership. We at Indigenous Services Canada, as we stated quite clearly, have control and reporting obligations on with respect to the communities that we are serving in terms of First Nations health, Inuit health branch. And those are really just a partial picture. They're as accurate a picture we can get with respect to First Nations communities on reserve, and a good picture of what's happening with respect to the Inuit, but less accurate, as I've mentioned before, with Indigenous populations living off reserve and Métis communities, and we get into a jurisdictional web, but it doesn't prevent. It just exemplifies the need that we need to have to coordinate our activities with our provincial partners. We've had some progress. We've been working with Dr. Smiley at the University of Toronto. We have also increased our cooperation with provinces and territories to ensure that we have accurate data coming back to us so that we can do two things again, get a better sense of what good public health needs good public data and a targeted response to reopening the economy as we take decisions that can impact the lives of people. And Valerie, maybe you can speak specifically on some of the other initiatives.
Yes, I mean, we have regular partner conversations, and what's exciting for me is getting briefed by partners about the data that they are receiving from some provinces, particularly in BC, Alberta, Manitoba, Ontario, where they're getting quite specific information about the number of their members that have been tested in community, away from community, and they are utilizing that information to guide their response efforts. So we would definitely encourage other provinces and territories that have not had an opportunity to look at the data from a First Nations, Inuit, and Métis perspective to work with their partners in their jurisdictions to be able to do that. As the Minister noted, we continue to work with the Strategic Alliance to see how they are going to be implementing their methodology with respect to their research and surveillance initiative. And they've recently submitted a more detailed methodological report to us, which we're absolutely looking at along with other federal departments. But I think that the best value and the most efficient way will be for First Nations, Inuit, and Métis to work specifically with provinces and territories on the data that they have in order to be able to extract from that information some profiles with respect to their population that they can make use of in their response efforts.
Thank you. Operator, next question.
Thank you. Merci. The next question is from Brett Forrester from APTN National News. Please go ahead.
Hello, Minister Miller. I think your strong condemnation and strong words will be welcomed, but what is your department going to do to make sure police killings don't happen in the future in Indigenous communities?
Well, Brett, as you know, and rightly so, politicians don't control the police force. That is absolutely not an excuse for impunity. We work hand in hand with the Minister of Public Safety, who is responsible for policing and responsible ultimately for the actions and policy of the RCMP. We communicate often our views and communicate the need on a number of levels as to what the actions of the RCMP are in community, local police forces as well. You have another dynamic of provincially delegated police forces, but it doesn't prevent us from stating our views privately and publicly, and ensuring that the communities and the feedback that they're providing to us as to their real and present fear with respect to people that are expected to serve them in their communities, to make them feel safe. The recommendations that have come out of the report, there are a number that focus on policing, increased needs for policing, and the way and manner in which policing is administered. My own riding in the city of Montreal has challenges in how it deals with Indigenous peoples. No one is immune from it, but by recognizing it, by speaking about it, by acting on it, by punishing those that are guilty of wrongdoing, we can move forward and all be safer as a nation. That's what we're doing, Brett.
Thank you, Minister. Brett, a follow-up?
Yes, thank you. My follow-up is perhaps for Dr. Wong. How vigilant should communities remain? As you say, most cases have recovered. How careful should we be in this lull in cases?
Thank you very much, for your question, Brad. It is extremely important to be measured, to be vigilant, to observe all of the outbreaks surrounding us in a community, whether it's in a location next to us, or whether it's in a factory or in a plant or in a mine in the industry around us, making sure that those facilities have all the infection prevention and control and the physical distancing for employees there, and making sure that virus doesn't get imported from areas at risk. It is very important that the decision has to be determined by the local community and the local community leaders, because one size doesn't fit all. There could be places, in Canada where there's a very hot and increasing number of viral transmissions. Those have to be taken into account. Also looking at the public health and the clinical health capacity around, your community to see, if, they have the capacity, to support the community. And of course, very important to continue all of the public health measures, including physical distancing, hand washing, and respiratory hygiene, etc. So with that, thank you for your question.
Thank you very much. We will now take questions from the room. Once again, one question, one follow-up. Nous allons maintenant prendre les questions dans la salle. Encore une fois, une question et une question suivie.
Marika Walsh with the Globe and Mail. Minister, I'm wondering if you can respond more concretely to what can be done. We've seen calls from the Senator and MP in Nunavut for body cameras. That's something that the federal government obviously could fund. That call has been made many times previously. I'm wondering if this is the tipping point for your government to actually fund it and ensure it rolls out, and if you agree with body cameras.
I wouldn't be able to see a lot of the footage that comes out from other jurisdictions without body cameras and absorb it. These are discussions that we have with police forces as to how they administer the conduct of their officers, how those officers serve and protect. If body cameras can fulfill that function, then I am absolutely for them. Obviously, with some of the footage, it hasn't prevented a number of the actions that you and I witness on social media or on the television, but they were one tool and among many. There's a lot of work to be done in training. There's a lot of work to be done in more recruiting and more representation of Indigenous peoples in the police forces, and not rank and file, senior leadership calling people to account. I have friends tell me privately that they have been discriminated against, that they've served in the forces. They've served in the RCMP. They're Indigenous and have quit for a number of reasons. One of them being discrimination, and that's unacceptable. I know that the forces have made moves, but perhaps not quickly enough. And obviously, with some of the really alarming stuff that we've all witnessed over the last couple of days, you spoke of a tipping point. I think there are many tipping points to consider over the next little while.
And in the case in New Brunswick, as you mentioned in your first response, it was police responding to a wellness check. We've seen calls from groups that say it's inappropriate that police are the ones responding to a wellness check, that they are not properly trained for this, they are not the appropriate people. Do you agree with that? And should police still be responding to wellness checks?
No, I have difficulty generalizing until I get the entire picture and the entire scenario. What I've seen, obviously, something went wrong and someone died, and that's unacceptable. I think we need to let the independent investigation take its course. There needs to be a full accounting. I want answers. Indigenous peoples in Canada want answers. Canadians want answers, and we expect them, and we expect them quickly. Thank you.
Good morning, Minister Miller. Ashley Burke, CBC News. Just to go off of that, what does it tell you about how police are equipped to deal with these calls that someone did die during a wellness check?
My initial reaction is not a positive one. Something went wrong in this interaction, and with deadly results. I believe in the rigor of an independent investigation. I think to the family of the victim, my deepest condolences. They need the facts. They need to know what went on and what went wrong. I think there's a lot of pain in communities across the country because of what this means and what it represents for a far too frequent pattern repeating itself. And this is a wellness check. Someone died. I can't process that. But I do need the facts, and I need to let people other than me investigate those facts, and I will respect that process.
The national inquiry, your government recommends that your government create a national police task force made up of independent investigators to review files of missing and murdered Indigenous women and girls. Why has your government not done this yet, and what message do you think this sends to victims' families?
There's been a lot of talk about, and it's the nature of the 1-year anniversary. It brings back painful memories to a report that came out a year ago. As I'd mentioned in a previous answer, review of police process and how it serves and protects all Canadians, all Indigenous peoples living in Canada, is something that bears more than sober reflection. It requires action. Now, the National Action Plan is not it would be wrong for it to be an instrument solely of the federal government. It requires input from principally Indigenous partners. It requires input from territorial partners and provincial partners. It requires not only leadership from Minister Bennett's office, from my office in terms of Indigenous services, with other ministries within government, including public safety, to your point. And so the action plan, and there have been a lot of talk. There's been a lot of talk about delay, but the action plan needs to reflect the care and caution, and most importantly, the voices that were put into the Missing Murdered Indigenous Women report. And if it is not ready, it would be imprudent and disrespectful to roll it out in a forum that does not reflect that level of input. But there is some progress, and I know this is a long answer, but there is continued work that needs to be done on all levels, including the way police behave and who reviews their action, and the work that needs to be done in the form in which it embodies, I think, should continue to have a level of oversight that represents the urgency. But it has to be part of a greater plan. Now, you have inflection points that we've seen in the last couple of days that may hurry that discussion. But I owe it to my colleagues to go back to them and discuss it to them as colleagues. Clearly, this action plan, if anything, our resolve is strengthened, but it isn't something that can solely be dictated from the bench of the federal government.
Thank you. Next question, prochaine question.
Todd Lamarand, APTN. This actually goes to Ms. Gideon. Ms. Gideon, I noticed during the very first answer that Minister Miller gave, you were nodding your head. And I just wanted to give you an opportunity as an Indigenous woman, if you wanted to comment about how you're feeling about what you've seen, especially this week.
I was nodding my head specifically about the minister's comment about how he felt in Tandanega, which I thought was a very excellent introspection. I had the honor of attending the event last year with respect to the submission of the final inquiries report, and I think it was an extremely emotional event, but it also, for me, demonstrated that there was hope for transformative change across the country, because it also touched upon all aspects of life, from health to economics to justice to all to children and youth, and the focus even on Jordan's Principle, which I also have responsibility for implementing in the department. And when I look at even just Jordan's Principle as an example, and I see the incredible amount of change that has enabled at an individual, family, and community level, it does provide me hope that it's not a short-term plan. It absolutely is a multi-generational plan. But I do feel honored that I will have a role in being able to move forward on a number of the calls to justice over time in partnership with First Nations, Inuit, Métis, and also provincial, territorial, and other federal departments. You know, we established in our department this year an Indigenous Women's Wellbeing Advisory Committee, which is co-chaired by Pauk Tutit and the National Aboriginal Council on Midwives. And I know establishment of a committee may not seem like something very transformative, but when you're looking at the establishment of a completely new department that had never existed before in 2017, which is not that long ago, and now the fact that we have an advisory committee that is very specific to looking at First Nations, Inuit, and Métis women, and the development of a collaborative plan which involves a multitude of different representative organizations, and hearing their voice, and for me, really listening and ensuring that we are responsive to what they are identifying as some core needs to support their members. And every 2 weeks or so, we have had calls with them to update them on the COVID-19 situation. They have shared with us what it is that they are doing to support their members. Extremely impressive work. And even sharing the guidelines for midwifery during the context of COVID-19. Like, these are things that I would never have seen in the federal government when I first started in 2007. So I continue to have and maintain hope that we will see that transformative change, at least a good chunk of it in my lifetime.
Minister Miller, you said earlier that in your opening remarks how well First Nations had done as far as flattening the curve. Is it time to have a national Indigenous body that deals with a possible second wave or future pandemics instead of having your department do it?
These are, Todd, and it's an excellent question. I do actually want to thank you for your previous question to Valerie. I think it's an important one that I couldn't ask her to speak publicly on. So I do thank you for that. The work that's ongoing and the discussions that we have with Indigenous partners is one that sometimes is imperfect, and I think that's what you're pointing to. Whether that's embodied in a national body, we certainly work with national Indigenous organizations. They tell us that they are not rights holders, and a lot of these discussions reflect the need with better coordination with them, and they do. You know, there's their very health boards that are headed up by political and medical leadership that we coordinate often with, and Valerie and Tom are in more than weekly conversations with, and that has been an effective working relationship. There's also very important regional bodies that we've worked with. It goes to the constant assessment and reassessment of what we do, how we do it, and how to do it in a way that isn't top down. I think one of the most important things that was done at the very beginning was to ensure that we reached out, and this isn't something that is done, in a grandiose fashion. It's done at a very local level, that we reached out with the local health leadership in each community through local FNIB, First Nations Inuit Health Branch authorities, to make sure that information was getting out, and that we had that contact point to make sure that, very basic things that don't cost a heck of a lot of money, washing your hands, observing social distancing, not to deny the fact that important resources needed to be deployed. But those are things that work, and things that did work, and things that we keep reflecting on. Now, whether we need a national body is, in fact, for me to decide, but there is a need for constant assessment and reflection on how we do things.
Merci. Next question. Prochaine question.
Hi, Mr. Miller. Mackenzie Gray with CTV News. On the incident in Nunavut, you said that it was a disgrace and that obviously hitting someone with a car is not a police tactic. The officer has not been suspended or fired. He's currently on administrative duties right now in the precinct, we would presume. If a regular Canadian, Indigenous Canadian, or anyone else was caught on camera hitting someone with a car, they would certainly be charged. Do you think that the officer should be charged and he should be suspended instead of still being paid and working in the office right now?
And thanks for the question, Mackenzie. That video evidence is damning, but I don't have all the facts. And I make no excuse at all for what happened. It's disgraceful. At the same time, you want to ensure that that justice takes its course. And that's something that I respect by allowing people to do the work they need to do to ensure that this person is properly dealt with. And I do trust people in that respect, and I trust the work that Minister Blair's office is doing, in particular, to ensure that does get done.
This morning, you were quite forceful in both the incident in Nunavut and various other incidents in your condemnation of what the police has done. Yesterday, the Prime Minister was asked quite specifically about the incident in Nunavut, and he had no clear response to that. He went back to what's going on in the protests. Are you disappointed that Prime Minister did not come out yesterday and give a more forceful response to something you've called disgraceful this morning?
I frankly have not heard what the Prime Minister said. You're telling me this for the first time. I'm sure he's equally outraged as I am. The footage was much fresher yesterday, and I think that's probably a question you should ask him.
Merci. Thank you, operator. We will continue with questions on the phone. Nous allons continuer avec les questions au téléphone. Opérateur.
Thank you. Merci. The next question, la prochaine question, est de Julie Marceau de Radio-Canada. À vous la parole.
Oui, bonjour, merci beaucoup pour cette portion en français. Monsieur Miller, vous avez utilisé des mots très lourds de sens en anglais, disgraceful, sur ces 3 incidents au Nunavut, au Labrador, au Nouveau-Brunswick. J'aimerais vous entendre en français là-dessus. Vous avez aussi mentionné la ville de Montréal, sur laquelle il y aurait peut-être des améliorations à faire. Donc, juste vous mettre d'abord ce que vous avez dit en anglais sur ces 3 incidents assez préoccupants. Là.
Ben, écoutez, Julie, et je vais vous donner une réponse très longue, comme je commence à avoir l'habitude. J'ai fait des patrouilles de nuit avec des gens qui aident les sans-abri à Montréal. Un bon nombre d'entre eux sont Inuits. Et j'ai vu la réaction de mes propres yeux en tant que simple député de la police de Montréal, qui était bien moins que parfaite. Que ce soit au Square Cabot, c'est un problème qui perdure. Et il y a des incidents plus récents que celui que je vous ai raconté il y a 2 secondes. La police se doit de servir et de protéger les Canadiens, peu importe leur race, leur croyance, leur orientation sexuelle. Les actes des 3 dernières journées que j'ai visionnés, ce sont des gestes disgracieux, honteux. On se doit, en tant que pays démocratique, d'avoir une révision indépendante des gestes qui ont été posés par ceux qui se doivent de protéger les Canadiens. Et, écoutez, je l'ai dit en anglais, j'arrive pas à comprendre comment quelqu'un peut mourir durant un wellness check, donc une visite santé. Je n'ai pas la traduction immédiate. Et donc, j'ai confiance que cette révision indépendante se fera et que nous aurons, que les Canadiens, que j'aurai, que le premier ministre aura, que les Canadiens auront et que les peuples autochtones vivant au Canada se doivent d'avoir dans le plus bref des délais.
Est-ce que je peux poser une question suivie?
Oui.
Monsieur Miller, vous avez peut-être vu, j'aimerais vous entendre sur le fait que tous les partis d'opposition à l'Assemblée nationale au Québec hier ont dénoncé un peu l'inaction, le manque d'imputabilité du premier ministre François Legault. Puis pour souligner l'anniversaire du rapport de l'INFADA, plutôt que de faire une déclaration ou envoyer un communiqué ou le souligner comme vous l'avez fait par exemple ce matin, c'est a mis un masque qui était fait par une femme Inuit et a publié ça sur les réseaux sociaux, sur Twitter. Et les partis d'opposition estiment que bien sûr, il faut soutenir l'artisanat autochtone, c'est pas ça la question, mais que ça manquait totalement de profondeur, puis ça présente une forme de nonchalance et certains partis allant même jusqu'à dire qu'il y a une certaine attitude coloniale du gouvernement Legault. J'aimerais savoir si vous cautionnez le fait que finalement, la seule façon d'avoir souligné cet anniversaire, c'est d'avoir porté un masque et d'avoir publié la photo sur les réseaux sociaux.
Je dois vous avouer, Julie, j'ai pas suivi cette nouvelle. en ce qui a trait aux actions imputées de M. Legault, je le laisserai parler pour lui-même. Je peux vous témoigner, en fait, de la relation que j'ai avec Mme Damour, dont la préoccupation, franchement, principale durant mes conversations, ça a été sa rétroaction avec la ministre Bennett en ce qui a trait à l'enfada et la contribution du Québec au plan d'action, puis je l'ai dit tantôt en anglais, qui se doit d'avoir la rétroaction des gouvernements provinciaux et territoriaux, ainsi des organismes autochtones, des organisations du leadership autochtone, ainsi que le gouvernement fédéral. Et donc, je sais, puis je l'ai vu des propres yeux, l'importance que Mme Damour, entre autres, témoigne envers ce plan d'action. Et sans défendre quoi que ce soit que je n'ai pas vu hier, franchement, je sais qu'entre autres, la ministre des Services autochtones au Québec travaille de façon diligente à produire un rapport avec la ministre Bennett ainsi que ses collègues au provincial. Et je vous demanderai de poser la question à M. Legault lui-même.
Merci. Opérateur, prochaine question.
Merci, thank you. The next question, la prochaine question, is from Dylan Robertson from Winnipeg Free Press. Please go ahead.
Hi, Minister, and thanks to the three of you for taking the time today. Minister, your office mentioned that compensation for Jordan River Anderson is something that you're exploring. I'm wondering if that means that you're actually committed to offering a compensation.
We are, and if you've read any of the court submissions, Dylan, you would see that has been communicated by our counsel. At the same time, these are conversations that are very painful and are best not aired in public entirely without, in order, in fact, to respect the discussions that we're having with the family and the important method in which we engage with the family is very important. And I would submit to you in all respect that is not something that we should be doing in the public domain. These will be very important and ongoing conversations with respect to a very painful subject matter. And it is the right thing to do for the Government of Canada to compensate the family, but it's something we will do without disrespecting the family, and that needs to be done privately. Thanks, Dylan.
And I wanted to ask about Indigenous ceremonies during COVID-19. In reaction to your comments, the Manitoba Premier Brian Pallister said that he would be asking the Prime Minister to sort of change the government's tone on this. I'm wondering if the Prime Minister has reached out to you about your comments on this.
Again, Dylan, I won't share any conversations I have with the Prime Minister. Regardless of what leader you're speaking about, we are all worried about the health and safety of Canadians. The respect for powwows, sundances, is something that the federal government needs to observe. This is a question not of a disagreement on the health and well-being of Indigenous peoples, but the way in which that health and well-being is respected and administered. And the best outcomes are outcomes that are led and driven, and I think we should keep saying it again, because there are tangible, measurable results when that engagement is done with and in partnership with Indigenous communities and First Nations. And as I've said before, if you respect self-determination, you must respect decisions that you don't necessarily agree with, but that underscores the importance. It underscores the importance of communication and dialogue. And I think if we've seen anything in the last month, is that engagement and dialogue is sometimes the difference between a positive result and armed conflict. And I'm not exaggerating.
Merci. Opérateur, dernière question.
Thank you. Merci. La dernière question est de Raymond Fillon de TVA. À vous la parole.
Oui, bonjour, M. Miller. Vous avez parlé de la police de Montréal. Qu'est-ce que vous reprochez exactement aux forces de l'ordre montréalaises?
Merci, Raymond. Écoutez, en tant que député de Montréal, tout comme n'importe député qui s'attend que ces forces de police protègent la sécurité des citoyens, peu importe leur race, leur croyance politique, leur genre. Il y a eu des incidents, vous les avez vus et vous avez fait des reportages vous-même là-dessus au cours des dernières semaines en ce qui a trait au comportement de certains policiers. Dans toute organisation, il y a des bonnes personnes, il y a des mauvaises personnes. Alors, vous me dites de condamner le corps de police de Montréal. Ce n'est pas le cas du tout. Ils sont là et ils sont là, la plupart d'entre eux, pour servir un mandat qui protège et qui sert les Montréalais. Dans certains cas, ça n'a pas été le cas et l'inverse est vrai. Donc, j'avais dit à votre collègue Julie que j'avais témoigné de mes propres yeux un comportement que je leur reprochais il y a quelques années. Il y a eu des incidents que vous avez rapportés vous-même, les faits, ou que vos collègues ont rapporté les faits. Et ce sont des incidents qui sont inacceptables. Et donc, dans n'importe quel état de droit, de démocratie pluraliste, on a le devoir de réaliser qu'on fait des erreurs, que les corps de police font des erreurs, que les gens se doivent d'avoir ce dialogue pour souligner le mandat qu'est le corps de police, que sont les policiers à travers le Canada. Dans les Premières Nations, par exemple, la grande revendication, parfois, c'est qu'il n'y a pas assez de police. Et c'est ce manque de ressources qui cause tellement de problèmes. Et est-ce que c'est de la discrimination? Parfois, oui. Alors, il faut se poser la question en tant que politicien, en tant qu'être humain, et vous les voyez même de vos propres yeux. Alors, aucune question pour moi de condamner les forces de police dans leur entièreté. Mais il y a des écarts de comportement qui sont inacceptables et parfois systémiques. Et dans ce cas-là, que ce soit le port de caméra, que ce soit l'enseignement qui est donné à ces corps même de police, qui doit être révisé, la sensibilisation dont j'ai fait partie avec plusieurs intervenants auprès des corps de police de Montréal, que j'ai témoigné de mes propres yeux, il y a plus de travail à faire et c'est le constat que j'ai.
Il y a tout un débat, M. Miller, au sujet des manifestations qui sont organisées à Ottawa, à Montréal, en raison de la COVID-19. Vous, en tant qu'élu, est-ce que vous encouragez les gens à participer à ces manifestations-là ou vous trouvez que c'est une mauvaise idée en raison de la pandémie?
C'est une importante question, Raymond. La manifestation pacifique, c'est un droit des plus importants dans une démocratie pluraliste telle que le Canada. Et donc, difficile de tenter de l'enrayer pour des raisons qui ne devraient pas, sans les raisons les plus sérieuses. Et donc, les consignes de distanciation physique doivent absolument être observées. Le port de masque doit se faire de façon raisonnée. Si ça peut se faire en respectant ces conditions, ces consignes hygiéniques, je ne peux pas m'objecter à la manifestation d'un droit des plus fondamentaux dans une démocratie comme le Canada. Look, peaceful protest is one of the most fundamental rights that a pluralistic democracy like Canada holds high, and it is the most fundamental right of expression against injustice when people feel they can't get it through other means. It has driven social change throughout Canada, throughout the U.S. Some of the most important leaders, like Martin Luther King, pushed heavily for this. It's something we need to respect, and if it can be done with observing and respecting physical social distancing, wearing masks, people washing their hands, then it's very hard for me to stand here and say these shouldn't happen. Peaceful protest is something, even when it's against us as government leaders, is important for us to respect. And so I'm not going to condemn it.
Merci. Thank you. C'est ce qui met fin à la conférence de presse. Thank you. This is what ends the press conference today.